Hi everyone, welcome to the video. Today I want to talk about appearance related things in regards to going on your nursing placement. Before I get started, I would just like to say that I have officially qualified as a nurse and I start my new job on Monday. I got my degree results and I got a 2-1 and I was very happy. I was very excited about that news because I honestly didn't think I was going to get a 2-1. So yeah, I start my new job on Monday and I'm very, very excited. So the first thing I want to talk about is tattoos. Now, I think that's probably the most concerning thing for people is if they have tattoos. What are people going to think when they go on placement? Are they going to be allowed to have their tattoos showing? The answer is yes. Unless they're offensive, then you can have tattoos on your body and no one's really going to care. I think it definitely does depend on your placement and the hospital and trust you're working in, but I've never had a problem with my tattoos. I've got one on my arm, which you can't see. I have one on my wrist and I've not been told off for having them. I've got friends that have tattoos all over their arms who do nursing and no, they're absolutely fine. As long as they're not offensive, then you don't need to worry about covering them. Number 2 sort of links with tattoos, it's piercings. I have a few piercings. I think I have 8. Yeah, I've got 2 down here and 2 up here. And I've got a plug here and then another piercing here. I've obviously got my nose pierced and my tongue pierced. I've not had any problems with my piercings. You can wear 2 studs in your ears. You can wear a nose stud and obviously a tongue bar. Again, it does just depend on what hospital you're in, what trust you're under, and different wards have different policies. I don't wear studs in my ears. I just wear this plug and the 2 up here. With my nose piercing, I just wear a stud, I don't wear a hoop. What I'd recommend doing is if you go to your placement beforehand just to see what it's like and introduce yourself, you can ask the ward manager then or ask someone then what their policy is on piercings. Or what I usually do is I wear what I'm wearing and then when I get there they either tell me off or they tell me to take it out, or I just sort of see what everyone else is wearing and see what I can get away with. Hair colour is another thing that some people look at a bit weirdly. I have had every colour under the sun in my hair since being a student. When I started my first placement, I had like half brown, half purple hair. I wasn't told off for that, but I kept dyeing it because I just loved dyeing it. It was so fun. And my hair ended up getting really, really damaged, really dry. It just wasn't very healthy. And I ended up getting it all cut off to like here, and I looked like a boy. I could get away with not putting my hair up then because it was off my shoulders, it was a bit shorter. But when it grew, I have to like pin it back and it was really difficult. And my fringe, because it was so short, it was just always falling like out. And there's literally nothing worse than if you've got gloves on or if you're sterile, like trying to do something and your hair just oh my god, it's so frustrating. So yeah, if your hair's really short, try and find a hairstyle that will be suitable for placement. Having your hair up as well, you obviously need to do that. Some trusts will say it needs to be off your collar, so sort of like this. If you're going to have your hair up, nothing touching here. But the ones that I've been in, they've been fine with me just having like a bun. So I literally just put it in a bun. I do it at the bottom of my head. I feel like it's a bit more supported there. Literally, it just looks like this. Right. It looks like this. It's out my face. Out the way. Patients can't pull it. Like, to me, there is nothing worse than a patient pulling your hair. I see these nurses in healthcare and whatever, and they've got a nice long ponytail like going down their back. And bitch, if literally, if a patient pulled that, oh my god, I'd scream. I would rather them hit me. Like, no, I can't deal with that. But by all means, wear a ponytail. But you never know, it could fall in a commode liner. It could like fall in a wash bowl when you're like giving someone a wash. And as I said, someone could pull it and no, really not very fun. I also want to talk about glasses. Now, I've worn glasses for, how old am I? 6 years since I was 16. No, 5 years. And it wasn't until literally January that I got contact lenses, and I honestly don't know why I didn't get them sooner. Like, they are such a godsend. On my placements, I wear glasses and they can fall off your face. They can fall into things. I have to put them on and take them off every time I want to look at the computer or write something. They were such a ball ache. I don't know why I never got contact lenses before. I also broke 2 pairs of glasses in 1 week on my first placement, because I'd come home and I'd fall asleep with them on or in my pocket and I'd break them. Yeah, fantastic. If you do break your glasses though, micropore is the best shit to fix it with. It is like sticky and strong enough that it was not going to fall off, but it's flexible enough to like move the arms. It's brilliant. If you want to stick stuff on your wall as well, micropore, it doesn't peel the paint off. What was I even talking about? Oh, contact lenses. Yeah, if you haven't got contact lenses but you wear glasses, just go and get a free trial and see how you go with them. If you're on a night shift though and you're going to have a sleep, make sure you take them out. There's been many times where I've forgotten to take them out on a night shift and I wake up and I'm like, oh. Obviously, like, you'll have your uniform, make sure you always look smart. Makeup wise, don't go too hectic with it. At the end of the day, you still have to look professional. But yeah, I think that's about it. Thank you very much for watching if you've made it this far. If you have just started your student nurse journey, then I wish you all the luck in the world. If you have any questions that you don't feel like you can ask anyone at uni, feel free to ask them in the comments down below and I will answer them for you. If you've enjoyed this video, make sure you give it a like and subscribe if you want to see more, and don't forget to turn those notifications on. Yeah, that's all from me. I hope you have a lovely day. Take care and I'll see you soon. Bye!